Hello, I'm Jeremy Fernandez. The coronavirus pandemic continues to change the very fabric of modern life. But for the first time this week, Australian authorities have been able to point to encouraging figures that show severe restrictions are starting to have an effect. The number of daily new cases across the country has fallen below 100 for several consecutive days. A large part of that is down to fewer overseas travellers who had previously made up a large proportion of those numbers. Now that there are fewer people coming in from overseas, we're getting a figure that reflects proportionally more community transmissions of coronavirus among local carriers. The Health Minister, Greg Hunt, says although the signs are good, strict measures will continue for some time.
The virus does not take a holiday. Therefore, none of us can relax in what we do. This, in many ways, is the most important weekend we may face in the whole course of the virus. If we can lock in the gains that we've made as a nation through the courage and sacrifice of those on the health and medical and policing front lines, but also through the immense goodwill and discipline of Australians, then we can help really protect Australian lives going forward and give ourselves the pathway through.
There's so much data charting the pandemic, it can feel overwhelming. But some experts say if there is one figure you should watch, it should be this. It's known as the growth factor, and this is Australia's. The main thing to understand is that we must keep this number below 1 to keep the pandemic under control. As you can see right now, we're doing that. But if it gets above 1, it means the number of new cases is going up. If it stays above 1 for a number of days, it means exponential growth or a very steep curve. If it stays below 1, we're flattening that curve and keeping things under control. Calculating the daily growth factor is as simple as taking today's new reported cases and dividing it by yesterday's new cases. You can see this in more detail by heading to abc.net.au/coronavirus. Of course, the growth factor will change over time, but for now at least, Australia seems to be headed in the right direction. So how does Australia stack up against the rest of the world? Well, Europe and the US have been of particular concern in recent weeks, and you can see that here reflected in the growth factor figures, where red is a day above 1 and green is below. Things look to be improving in Spain. They've had a few consecutive days below 1. The US has dipped just under in the past 24 hours, but have consistently been in the red for the past month. It's important to note that some experts believe that the testing regime in Australia, which focuses on overseas travellers, could be hiding an increase in community transmissions across the country. But from the confirmed cases so far and current growth factor, it seems Australia is headed in the right direction. Well, those figures come on the back of government modelling that's rammed home the importance of social controls. If the pandemic were left uncontrolled, the strain on the health system, in particular intensive care units, would peak at about 35,000 a day. That's about 28,000 more than the current capacity. The second scenario, which enforces quarantine and isolation of confirmed cases, would peak at 17,000 ICU beds. That's 10,000 above capacity. And the third modelled scenario, which adds social isolation to the mix, peaks at 5,000 a day, which is manageable. Well, the deaths of a man in Victoria and another in New South Wales have taken the national toll from coronavirus to 53. The total number of confirmed cases has now risen to just over 6,200 after an increase of 99 today. You can see in this chart how we compare to the rest of the world. Of course, population densities need to be kept in mind when looking at these total confirmed case figures. But it is clear the differing levels and implementation dates of control measures have directly influenced the growth curve in each country. The biggest economic rescue package in the nation's history passed federal parliament with bipartisan support this week. A mammoth $130 billion scheme is aimed at helping an estimated 6 million workers. Political editor Andrew Probyn outlines the spending.
The $1,500 a fortnight JobKeeper payment rolls out from May. To qualify, a business has to suffer a 30% fall in turnover. That threshold's been halved for charities, while big businesses will need to demonstrate a 50% fall in turnover. Anyone who misses out can apply for the Job Seeker Allowance, the rebadged unemployment benefit, worth $1,100 a fortnight, even more when other payments are added.
This, the People's House, will deliver for the people of Australia.
This is good legislation. it will make a difference to people as a result of what we do in this parliament.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
The number of cases worldwide now exceeds 1.6 million. That's doubled in just 10 days. The US continues to see an alarming rise in its new cases and deaths. It's recorded its single biggest one-day death toll from coronavirus. Almost 2,000 people died, more than a third of them in New York. Images from Hart Island in the Bronx have shocked many Americans. Inmates have had to put on protective gear to dig mass graves. The site has been used for more than 150 years by city officials as a mass burial site for those with no next of kin or families who can't afford funerals. Dr. Anthony Fauci, a key member of the White House's coronavirus task force, says the final number of Americans who will die from COVID-19 in the outbreak looks like it'll reach more than 60,000. With the constant information barrage, it can be hard to drill down into what exactly it all means for you and your loved ones. We've had tens of thousands of questions come into us here at the ABC. So to help, we put some of your queries to Melbourne-based GP Dr. Viom Sharma and national medical reporter Sophie Scott. It is the Easter weekend, of course, and we have a question here that we received through our ABC News website. Can my neighbourhood have an Easter egg hunt where residents leave all the treats on the doorstep for children, so they're not handing them out personally to them, and then small groups in pairs go around and collect these treats from other people's doorsteps as a way of getting around the physical distancing rules and regulations? Dr. Sharma, what's your view on that?
Well, I think I heard a bit of scepticism in your intonation there, Jeremy. I think you're right. I think we have to be blunt here. I don't think it's safe. So it's not just enough for humans to be spaced apart. The point is that this virus can transmit through fomites, that is to say, just objects on which droplets might land. So if we've got multiple kids coming up to doorsteps and they're touching, say, the receptacle that the Easter eggs are in, and they're going from kind of house to house, this is a significant risk. Now, we could argue for any amount of safeguards and, we'll clean the bowl and we'll clean the plastic foil of the eggs and everything else. It's just too much of a risk to take. And I think the thing people need to remember for Easter is that if we get this one right, if we can celebrate it without being in each other's faces, we're helping ensure that our family and many other families will enjoy many Easters together for the future. So I don't think it's wise to do this.
Sophie, here's another question on a related note around surfaces. If you have a cut or abrasion on your hand, does that increase the chances of contracting the disease if you touch an infected surface?
Well, that's interesting. I guess you would need to think whether there was some droplets getting into that cut. You'd need to find some way that it was actually going to become invasive. So I think it would be unlikely, but I guess it would be, a good idea if you do have any cuts or anything to be making sure that you're wearing, proper Band-Aids and bandages and not having exposed wounds at this point. But what do you think, Dr. Sharma?
Well, I think it's a really good question. It demonstrates the complexity. So if we just go by infection control principles, the skin is probably the biggest immune barrier there is. And so if that's breached, then by all means, that means that if droplets were to get in, that might be a risk. Now, there's other factors there too. For example, the SARS-CoV-2 virus loves to attach to parts of the body that has these ACE2 receptors. Now, are they at the specific site you've got the cut, and who knows? And are we going to run the trial on half the people with cuts and half the people without cuts and see who gets the infection? No. It's very sensible what you're saying. Cover the cut, take every precaution possible while we learn more about the virus.
Another question here from Lara Jane via our Facebook channel. Lara, thank you for your question. Do you think these isolation rules will be relaxed soon? Someone else on our website asked, will all restrictions stop at once, or will we be allowed to congregate with, say, 4 people on one day, 10 people a month later, and so on? Sophie, how do you think this is going to gradually ease?
So, look, I think a lot of people are thinking about this. They're thinking about, given the good news we're getting about the figures, that they're thinking about the road out, which is the term the government's using. And The government's actually sort of got some experts doing modelling on this to look like what that road out could look like. I think it's too early to say, to be frank, what that would look like. But I think we'll know once we look at the data from the Australian population that have coronavirus, what that's looking like in terms of the numbers of people, the level of community transmission.
This is something, as Sophie says, it's on a lot of people's minds, and it's difficult to communicate how we might take one step forward, 2 steps back, 3 steps forward.
Yeah, the thing people have to remember is it all depends on how this virus is transmitting, and we're waiting for feedback on that. So there's a lot of questions about, well, when are these measures going to be relaxed, and what that's going to look like in reality. It depends almost entirely on what's going to happen with this curve, and very likely we are going to see, if there is any relaxation, a very graded relaxation. So I cannot imagine a circumstance where we will go from where we are now to let's have the NRL. It's going to be graded, foot off the pedal in local ways. We'll see what the viral transmission is doing, and then we'll respond accordingly. You're not going to go from 0 to 100.
As we've heard repeatedly, it seems that a vaccine is at least 12 to 18 months away. Beatriz Vallador of Facebook asks, will coronavirus until then repeat each year like the flu? And what are the chances of a vaccine actually being reached inside that time frame?
So it's one of the main theories that's being posited by a lot of virologists is that something that's just going to become part of our environment, this soup of microorganisms that we live in. And look, I think it is very possible that we are going to have a vaccine. The time frame, on one hand, 18 months is an optimistic time frame. On the other hand, I mean, has there ever been a more concerted effort to build a vaccine towards a single organism? We can do some pretty extraordinary things. I wouldn't be surprised. And not to mention, vaccines are not the only form of treatment we're looking at. We're looking at potentially antibody treatments from the serum of people who've recovered, and medications that might be able to mitigate things. So there are many reasons to be quite optimistic. But a vaccine looks like perhaps the most surefire population-based way to attack this. And what can I say? There's people who are working very hard on it, and if we're lucky, we'll get something sooner than 18 months. I
want to come back to this question about isolation, which has a few people tied up in knots. Very simple one. Can we get a car service?
So I think, with the car, getting your car serviced, I think if you don't need to do it, then I would put it off. I've put getting my car serviced off. Because I don't think, unless I need it desperately at the moment, I think it's, again, the risk-benefit analysis, and I don't think, my car is fine. I don't really need to get it serviced at the moment, so I'm putting that off. On the other issue of getting a car service, like coming to pick you up, like an Uber or something like that, again, it's a risk. The advice is to sort of sit in the back seat of the car and to not, make sure you're disinfecting, washing your hands if you can when you get out. But again, it's still not, you're still going into an environment where you really don't know how well cleaned that environment is, and whether the person that you're getting the lift from might even have the virus and not know it. So it's again a bit of a risk. What do you think, Dr. Sharma, about those two things?
Look, the car servicing, if we're talking about, actually fixing up a car, my car is total trash. And it probably is due service. And there's almost this kind of trade-off of, what do I really need the car for? And really, the reasons personally I think I would need the car is to take care of my family, who my father's actually quite frail and ill, and one would argue that I need to have an efficient, safe method of transportation. So it's one of those excellent kind of nuanced questions. There's so many kind of layers to, but anything that I can put off, I will put off very confidently. So I think that, kind of the guts of your answer is just spot on.
Well, there were many more questions and answers. You can check out our full 40-minute chat on the ABC News YouTube and Facebook channels. We'll be streaming those live question and answer sessions every Friday at 3:15 Eastern Standard Time. The advice, rules, regulations and even research findings are changing and evolving rapidly. You can stay up to date with the latest on the special coverage page of the ABC News website. That's abc.net.au/coronavirus. Keep the questions coming. Thanks for your company. We'll be back with you again next week. Bye for now.